This video is being uploaded for evaluation purposes. Today, my topic of presentation is an overview of diabetes mellitus. So, diabetes mellitus is a combination of two words. One of them is Greek word that is diabetes, which means siphon or passing through, and the other is Latin word that is mellitus, meaning sweet or honeyed. Ancient Greek, Indian, and Egyptian civilizations discovered the sweet nature of urine in this disease, hence, the propagation of the word diabetes mellitus came into existence. Basically, diabetes mellitus is a metabolic disorder characterized by hyperglycemia resulting from number 1, defects in insulin secretion, number 2, defects in insulin action, or both of them. On the basis of these mechanisms, diabetes mellitus can be classified into diabetes mellitus type 1 and diabetes mellitus type 2. 5 to 10% of patients of diabetes mellitus are related to type 1 diabetes mellitus, which is characterized by an absolute deficiency of insulin secretion caused by pancreatic beta cell destruction, usually resulting from autoimmune attack. And 90 to 95% of diabetes mellitus are related to type 2 diabetes mellitus, which is caused by a combination of peripheral resistance to insulin action and an inadequate compensatory response of insulin secretion by the pancreatic beta cells, which is known as relative insulin deficiency. It is also important to note that type 1 diabetes mellitus and type 2 diabetes mellitus were earlier known as insulin dependent and non-insulin dependent juvenile onset diabetes mellitus, adult onset diabetes mellitus, respectively. But nowadays, the studies has shown that this name is a misnomer for these two types of diabetes mellitus, because type 1 diabetes mellitus may develop in patients who are much older, whereas type 2 diabetes mellitus can develop at younger age groups, due to the childhood obesity. As far as its etiology is concerned, type 1 diabetes mellitus, type 2 diabetes mellitus has been described. Some more causes may be added to this etiology, that is genetic defects of beta cell function, genetic defects in insulin processing or action, exocrine pancreatic defects, endocrinopathies, viral infections, some drugs like corticosteroids, thyroid hormone, interferon alpha, protease inhibitors, etc. There is also uh, a factor which is included in etiology of diabetes mellitus, that is gestational diabetes mellitus. Now, coming to the clinical features or clinical presentation of diabetes mellitus. Most of the time it becomes asymptomatic, particularly type 2 diabetes mellitus. And the symptoms which occur may be polyuria, may be nocturia, polydipsia, polyphagia, unexplained weakness, weight loss. These are the clinical presentation of diabetes mellitus. Now, coming to the diagnosis of diabetes mellitus. how this disease is diagnosed. So according to the American Diabetes Association and World Health Organization, diagnostic criteria for diabetes mellitus include number 1, a fasting plasma glucose more than or equal to 1 to 26 milligram per deciliter. Number 2, a random plasma glucose equal to or more than 200 milligram per deciliter in a patient with classic hyperglycemic signs, that is polyphilia, polyuria, polydipsia, unexplained weakness, etc. Number 3, 2-hour plasma glucose equal to or more than 200 milligram per deciliter during an oral glucose tolerance test with a loading dose of 75 gram and a glycated hemoglobin, that is HbA1c level equal to or more than 6.5%. It is also important to know that there may be impaired glucose tolerance, that is known as prediabetes, which is defined as a fasting plasma glucose between 100 and 125 milligram per deciliter, that is impaired fasting glucose. 2-hour plasma glucose between 140 and 199 milligram per deciliter following a 75 gram glucose, and or a glycated hemoglobin, that is HbA1c level between 5.7% and 6.4%. That's it from my side. Thank you very much.